Hi guys, welcome to my video. So today I'm going to speak a bit about applying for assistant psychology posts. So if you are interested in understanding the process of application a bit better, or what an assistant psychology role might look like, then this video is for you. So I've been working as an assistant for around 3 years, and I've been in two posts. I'll explain a bit about the posts in a second. So the nature of the role will vary depending on what type of service you are working in. So my first role, I was working in an adult community psychology service, and the focus was kind of complex trauma and personality disorder. So in this role, I had both admin tasks but also clinically relevant tasks. So, in the admin side of things, I was managing the databases. So, on the databases, it usually had information about all the clients that have been referred into the service and what kind of therapy they're waiting for. So I would be kind of in charge of updating the databases, ensuring that the right people are closed at the right time or opened at the right time, and completing the admin task to do that. And in the clinical side of things, I would conduct risk review calls for those who are on the waiting list for psychology. So what that would look like is calling clients once a month to make sure they're doing okay and to see if they need any additional support. I also was helping to run psychoeducation groups for new referrals, which usually happens online, and we spoke a bit about understanding what is psychology and understanding our service as well, and what an assessment might look like with us. And then I was also running something called STEPS, which is a manualized group intervention for clients who might present with personality disorders, and kind of supporting them in helping to regulate their emotions and their mood. So I really enjoyed that role, and it was my first role, so I learned a lot about how the MDT works together and how psychologists work within the NHS. So from that, I went on to my second role, which was an assistant psychologist in an early intervention in psychosis team, which basically supports clients who might have had their first episode of psychosis. And in this role, I also did a very similar thing with databases, kind of like managing the waiting list, but I was running something called the carers wellbeing intervention. So this is where you might meet the carers of someone who might be impacted by psychosis, and you go through psychoeducation about what psychosis is, the causes, the treatment, and then also thinking about the carer's own well-being, because it can be a really stressful time for carers. So that role really taught me about systemic working and how we can work alongside family members and carers of someone who might be impacted by psychosis. So it was a bit of a journey to get onto both of those roles, really, and I'll kind of explain a bit about my own journey and then a bit about the actual process of becoming an assistant psychologist and a couple of tips and tricks I learned along the way. So after graduation, I actually wasn't sure that I wanted to go into a psychology kind of like mental health career, mainly because of all the information I received about how competitive it was. It kind of put me off, and I didn't really have that much faith that I can battle through all of that competition. And I was working in an internship at a more corporate role doing research analysis, and if I'm honest, I was really bored and I really didn't enjoy it at all. And I knew when I was in there, like, this type of office environment is really not for me. So because it was a 3-month internship, at the end of 3 months, I was looking at other posts to apply to. And then I stumbled upon a post which was part of the Aspiring Psychologist program, which is essentially an assistant psychologist post for people coming from a BAME background or working class background to kind of improve accessibility for people from those backgrounds in the psychology field. Program, it didn't have any requirement that you had to have experience as an assistant psychologist or really specific clinical experience, just an understanding of psychology in general and being able to explain why you want to get onto that role and what you would like to achieve. So I stumbled across that one and I applied for it. And luckily I went through the interview and I got in. So that was my post. I'll put a link in the description regarding the program. So people from a similar kind of background, you can look out for that. And I think there's a mailing list that you can join and they'll give you kind of updates for it. I would say it's still very competitive, so it is important to have some kind of experience like volunteering, which I did, related to mental health, to kind of show that you do understand a bit about the nature of working within mental health, and also having a very tailored personal statement, which I'll go into, and then also being able to like nail the interview. So in terms of experience, I would say if you are an undergraduate psychology student or master's psychology student, you should definitely think about volunteering within mental health. And usually unis do have like a volunteering service where you can actually reach out to the uni itself to find out what volunteering opportunities they have. But examples of some volunteering I did was the Shout helpline, which is actually a really lovely platform where you volunteer to be part of a crisis tech service. So people who are really struggling might reach out, and then you kind of have an online conversation with them to help de-escalate the situation. And whilst you're training to become a volunteer, they teach you a lot about how to identify risk and how to assess risk in a person's mental state. And they also teach you in terms of how to kind of like de-escalate the situation and what you do if you feel like you can't really manage a particular situation and it does need to be kind of escalated above and further. So I think that experience really helped me in terms of managing conversations with someone who might be struggling and understanding what services and support is out there. So I would really recommend that for anyone who's interested in getting some experience. But I was also volunteering for CAMS, so they had like a befriender volunteering scheme where they match you with a client from the service who might want to get out in the community more, or just kind of like have someone to talk to outside of kind of that clinical space. So I would be volunteering there as well. And then there's stuff like Age UK, Mind, those mental health charities that often have a lot of volunteering places available. So I think it's really important, if you are interested in becoming an assistant psychologist, in making some time to volunteer somewhere, or even thinking about a part-time role, because I know volunteering isn't accessible for all people. So even thinking about a part-time role as a care worker or a part-time role as a support worker. And usually if you go on the NHS jobs website, you can literally type in support worker or even healthcare assistant and have a look at those. So those roles are usually entry level, where you are in that environment with patients, and you can kind of learn a lot because you'll be working alongside other healthcare professionals. So you could have a look at NHS jobs and see what's out there. I would say if it's kind of catered towards clients who do have mental health difficulties, that would be really great. But then also it can be hard to find that. So even if it's just in general working to support people, that's also equally as great, because all of those things teach you transferable skills that you can write in your personal statement, or you can bring to an interview to kind of show that you do have some experience working with different populations in a healthcare kind of environment. And I will paste some useful links in the description to help you kind of find some of these roles. So once you do feel ready to apply for the assistant psychology post, I would say go onto the NHS website and read through what is available. Now, with posts in London, they are quite competitive compared to the ones outside of London. Like, I remember when I was applying for posts, they would post the advertisement in the morning of the day or whatever, and then at like 11 p.m. or 12 p.m. the post would be gone because they've had too many applicants, and usually they're capped, so like once the post receives like 50 applications, the post automatically closes. So it's important to bear in mind. So if you aren't geographically kind of like tied to London or like a specific area, it might be helpful to apply to ones that are a bit far away or in other locations. But I know that's not accessible to all people, but it's just something to bear in mind. So I guess the important thing when you're first applying is also to think about the personal statement. So with usually assistant psychology posts, they do ask you to put a bit of like a cover letter or personal statement explaining why you'll be suitable for the role. And what I did when they asked these kind of questions is to open up the job description and look at what their person specification is. So each post will put a kind of like list of things that are essential criteria and desirable criteria. So when I was first writing these statements, I would want to make it so detailed and like flowery and nice to read, but honestly they are not looking for that. I've spoken to people on the panel for assistant psychology interviews, people who shortlist, and they are not looking for something flowery and long, and they just don't have the time for that because they're probably looking through 100 applications or 50 applications, and they also have the work that they're doing, so they don't really have much time to really digest everything. So the time that I was seeing my applications being more successful is when it was really succinct, and I made sure that every single specification that was outlined in the description, I was able to explain how I met it. So if it was like they expect you to have experience working in mental health, I would put directly like I have experience working in mental health when I was doing this volunteering or that volunteering role. So make it so obvious, like pretend that they know nothing about mental health, pretend that they know nothing about you, which is true, they don't know anything about you. So make it so clear, fit it in to that personal statement. And obviously ChatGPT and AI is a very easy way of kind of doing personal statements, but I would strongly kind of advise against using that because it's very clearly obvious when someone has used AI to kind of generate a text. I guess you could use it to get some ideas of how you might approach things, but don't copy things word for word. Don't actually make it write the statement for you, because through the statement they're also seeing your personality a bit as well and what kind of writing style you have. So I would just strongly advise you against using AI. So this is the kind of challenging part, and especially for me, I was so nervous when it came to interviews. I think there's a few key points. So the first point that I would say is make sure you research the service that you're going into. So have a really good understanding of what the service is, and if you can find the information like how the referral process works, what does the MDT look like, and what kind of clients might be referred onto the team and things like that. And with also the service, if it's a service, for example, focusing on supporting people with psychosis, do your research on psychosis. You don't need to do some in-depth analysis on all the research papers in psychosis, but just go on the NHS website, read up what they say the causes of psychosis are, the treatment of psychosis is, what do the symptoms look like. You don't need to be an expert, but having some general knowledge about that topic is really important. And obviously extra bonus points if you are able to say like, I read this recent research paper on psychosis and how they might promote, carers' well-being intervention in recovery, something like that. But obviously you might not have the time to do that, but if you do, that could be beneficial in terms of showing that you are really interested in this area. So whatever service it is, just do your research into it. Usually they do just want to know that you are someone who is not afraid to kind of like ask for support, and you know what limitations you might have as an assistant psychologist. You won't know everything, but you would know where you can go to get extra support, or what you might do if a patient is in a crisis situation, and what kind of things you think you would do in that situation. I think that's really important is diversity and individual difference. So how would you work with a client who comes from a different culture or a different background, or how would they understand mental health? Because different cultures might come with different understandings of mental health, and they want to see that you're aware of that, especially in places that are really, really diverse. They might not directly actually ask you, similarly to supervision. So you can think about how are you going to weave that into the answers that you're giving. So even if they asked you like, what is depression, or how would you treat depression, you could say the general stuff about what depression is, but I think bringing in diversity, so understanding that in different cultures there might be a stigma against depression, so clients who come from a different background might require a bit more support into getting the help in the first place. So saying things like that and weaving it into your answer shows that you have a really good understanding of mental health, and different people's perspectives of mental health as well. And then thinking about individual differences, it could be stuff like neurodiversity. How would you maybe work with someone who might present with some traits of autism and things like that? They might, like I said, not directly say that, but thinking about how you might weave that into your answer as well. It's quite important as well. And I think it might be beneficial for you to have some understanding of some psychological theories. So maybe like cognitive theory, or the CBT model, just how it generally works. Usually they don't really ask, in my experience they haven't, but when you're prepping it might help you to just kind of understand how people might think and behave, and how that might impact their mental health as well. So another technique that you can use when you are answering interview questions is the STAR technique, which you might have heard of. So first you kind of explain whatever situation it was really briefly to set the scene. So for example, if they're asking you explain a challenging time that you might have had at work and how you dealt with it. So first you would explain the challenging time, and then the next one is the task. So thinking about what is it that you had to do in that moment that was difficult, and then action. So explain how you actually went about doing it, and then the result. So what happened from the whole situation and what did you learn from it, and thinking about maybe what could you do in the future, or what you might have done differently, or even if you wouldn't do anything differently, why is it that you think that whatever approach you did was good. So I think that that's also a helpful technique, and it's easy to remember in the interview setting. And just in general with the interview, it can be really kind of frustrating when you've tried so hard in an interview and then you don't end up getting it. But speaking to people who do conduct interviews, they have said stuff like when they are interviewing people, they also want to see if that person would fit in with the team. So even if you do give all the perfect answers, someone might get chosen over you, maybe because of like how they think that the person might fit in to their team, or how they think the person might approach certain situations. So just kind of on that note, you don't need to say all the perfect answers, and they don't expect you to know everything, because you're only going to be the assistant and you're just learning, but they want to know that you're proactive and you're open to learning. So don't take things to heart if you don't get in, And usually they do give feedback, which I found really helpful when I was going through the interview stages to kind of work out what I need to improve on. Sometimes it is down to chance and down to luck, down to who else is competing with you, which is just unfortunate, which is why I would also say just apply to as many posts as you can. Because even after my first assistant post, I was struggling to get another one, but I was applying to maybe like 7 or 8 posts, and regularly checking the website. So you do need to apply to quite a few, which can be draining. So look after yourself during that process as well. So I think once you are an assistant psychologist, there are things that are important for you to do in your role. So the first thing I would say is to be proactive. So usually working in a psychology service, it can be really, really busy, and thinking about other things that you can do that might benefit the team that maybe your supervisor won't ask directly. So if they do have databases that are a bit outdated, are there ways that you can kind of improve it or improve the formatting? Or are there any suggestions that you might have to kind of improve some of the systems in the team? And obviously not everything is going to be actioned by the whole team, but there might be really helpful insights that you can provide. And just because you might feel like you're only the assistant, it doesn't mean you don't have valuable kind of things to contribute in the team, because sometimes you can feel, I guess, well, me personally, at times I did feel a bit inferior, like, I don't have that much contribution to the team. But then when I started vocalizing a bit more and speaking out my own ideas and thoughts, it was really well received. And supervision can also be a really great place to do that. And I would say also focusing on networking and making connections with the psychology team and also the wider MDT. I think in some teams, the psychologists tend to stick in their little bubble, but when you do go out and speak to other people in the team, like the nurses and the occupational therapists, you really do get a different insight into how I guess patients are being looked after in the team. And that also helps you build skills for if you are thinking about the decline, and understanding how the whole team works together cohesively. So I think that's a really good thing to do, so networking. And I also think in terms of the actual role itself, you can feel a lot of pressure once you've got on to be perfect and amazing, but you will make mistakes, and that's completely fine. And when things do get hard, speak to your supervisor. And something that really helped me is to establish hobbies outside of work. Think about things that you can do for yourself rather than get so engrossed into the psychology world and the psychology careers and progression, because it can be challenging at times, especially when you're an assistant and a lot of the posts are limited or fixed contracts. So it can be worrying, thinking about what am I going to do next. So establishing a really good work-life balance and other stuff outside of the whole psychology world can be really helpful, and genuinely makes work easier and more fun, because you are more focused on work during work time, and then you have your other things to do and fun stuff to do outside of work. So really looking after yourself, I think, is important. So that's the end of the video. Like I said, I will be posting more in-depth videos about interviews and the personal statements, and creating resources to support you with that as well. And I will create videos into how to get onto the decline and my experiences of that. So definitely subscribe if you are interested in finding out more information regarding that. Thank you for watching.